Hi, Lucy. Lauren Martell here, the behavior analyst who is working with your son, Jack. Just as a recap, Jack is a 13-year-old boy who has autism spectrum disorder. You were referred to us originally for some urinating on the floor behavior, and several weeks back, we kind of implemented some strategies in order to assist with that. So we reinforced voids in the toilet, as well as we reinforced a period of time in which he didn't engage in urination on the floor behavior. Jack is a kiddo who a long time ago had toileting training, and he independently uses the toilet for bowels and urine on a daily basis. So urinating on the floor behavior was really a behavioral difficulty that we wanted to target. I'm sure you can remember initially we did lots of baseline and we did functional analog in order to figure out what was going on. And we really, the data showed us that he's peeing on the floor on a daily basis because he likes it. It's not maintained by any social consequence. He just likes it. So it's something we call automatic reinforcement. Okay, so based on our data from our reinforcement interventions that we've put in place, we see a little bit of a decrease in urinating on the floor behavior, but it's still there. So I wanted to take today to draw your attention to the research, talk about implementing an additional procedure onto our current intervention plan, and then using a BST approach to learn this new strategy. Okay? So, way back in the 70s, our toileting gurus were Azrin and Fox, and they really spoke to how we can decrease inappropriate toileting behavior for individuals like Jack, but also increase appropriate toileting behavior. And they spoke to something called overcorrection. And the premise behind this strategy is that when the individual disrupts the environment, we're going to have them return the environment to the original state, as well as, do extra practice of completing that positive procedure. So what that means is, let's say Jack were to spill his milk at the kitchen table. We would have Jack wipe up his milk, but then also maybe wipe up the rest of the table. Some other researchers, such as Freeman and Pribble in 1974, spoke to this, and then even Matson and colleagues in 1979 spoke to this. And Matson in particular talked about using overcorrection for individuals who are roughly 12, 13 years old, again, just like Jack, to help decrease urinating on the floor behavior. And they found really, really nice results. They saw that overcorrection helped rapidly decrease this behavior. But just to make sure we're not only utilizing punishment with Jack, we're going to maintain all of our other reinforcers that we're currently using for appropriate peeing on the toilet, but we're just going to add in overcorrection. So today I'm going to use something called the BST approach. This is a well-researched procedure for teaching mediators on how to implement a new skill with their children. So we're going to use this approach. And what it is we're going to go over the instructions on how to complete overcorrection. I'm going to model it for you. I'm going to give you the opportunity to practice it with me. And once we master it here, and once I give you some feedback on that, I'm going to get you to practice with Jack. And I'm going to give you some feedback there as well, just to make sure you feel really comfortable implementing the procedure. Okay? All right, so to start us off, I'm going to get you to refer to your handout where it outlines exactly what we're going to do with Jack. Okay, so the first thing is when Jack starts urinating on the floor, you're going to approach him and in neutral tone, you're going to say, "It looks like you need to use the bathroom." Okay, and then you're going to gesture towards the bathroom. If after 5 seconds he doesn't go towards the bathroom, you're going to place your hand gently on his shoulder and you're going to guide him there. Okay, have him stand in the bathroom and stand over the toilet for about 10 seconds. If he urinates in the toilet, you can give him some praise for that. But whether or not he does, immediately after 10 seconds-ish, you're going to pull up his pants and you're going to gesture to the mop, which is going to be located right beside the toilet. You're going to then gesture to the place where he urinated on the floor in your home. And again, if after 5 seconds of your gesture, neither of those things are happening for Jack, you're going to assist him with that using hand-over-hand prompting. So you can grab his hand gently, have him grab the mop, and then you can guide him towards the spot where he urinated on the floor. Okay? Then his task is going to be to clean up the urine with the mop, as well as spend about 5 to 7 minutes maximum cleaning up other parts of the floor. And that's essentially the procedure. Let me model it for you. So let's pretend Jack has just urinated on the floor. I'm going to say, "It looks like you need to use the bathroom." I'm gesturing towards the toilet. Jack goes there, 10 seconds passes. Okay, I pull up his pants, and then I'm going to gesture to the mop. Let's pretend he didn't go. I'm going to take his hand, and we're going to grab the mop, and then I'm going to guide him out to the floor. I'll take a look at the clock. I'll keep an eye on 5 minutes, and I'm going to have him clean up his mess, and he'll clean up the rest of the floor. And I can say things like, keep going, keep cleaning, that sort of stuff, okay? So then let's say 5 minutes is up. I'm going to say, awesome, you're done cleaning, Jack. I'll take his mop, and then he can go about and continue on his activities for the day. If it happens again, I'm going to implement the exact same procedure. Okay, so now it's your turn to give it a try. If you have any questions, please don't hesitate to let me know, and I'll just be filling out a treatment adherence checklist as you go, and then we'll talk about it after, and we'll make sure that you feel really, really comfortable implementing this procedure before I get you to do it with Jack.